and welcome to Mental Health Now. My name is Ramses Vargas. I'm a board certified psychiatric nurse practitioner practicing in Arizona. I am new to YouTube, however, I feel that I've grown a platform on TikTok and I feel that I resonate with a lot of people and people like to hear what I say and ask me for tips. And making a switch over to YouTube and doing both for a while is more consistent with what I want to do so I can reach a larger population. A little bit about myself. I've been in healthcare for 12 years now. I started as a certified nursing assistant. I worked for 2 years at a nursing home on a long-term care unit. Third year, I worked in a lockdown dementia mental health unit where they kind of put a little bit of everything from older patients to patients in their 30s with schizophrenia or patients in their 40s with Huntington's disease, SMI population that really had no other place where they could be cared for. That's where I really fell in love with mental health. After the nursing home, I worked as an LPN, a licensed practical nurse, for a few months, and then I started working at a prison, and I fell in love with the prison, and the prison showed me a whole different world of healthcare that I immediately became immersed in. I definitely enjoyed my prison career as a nurse. I moved up. I liked it so much that I went on to other facilities, jails, federal prisons, and I worked there for a total of 10 years. And then my last 2 years I worked as a psychiatric nurse practitioner in the state correctional system in Arizona. During that time, I made a lot of great memories and a lot of coworkers and a lot of things that I will never forget. Also during that time, I was kind of planning my escape and getting out of prison, so I was opening up my own practice, which I did successfully open up a private practice in 2022. That didn't last a long time because I was only taking cash pay. However, now that I'm out of corrections, I want to focus my attention more on the community, and part of that is opening up my practice again. So I'm going to be walking you through that journey that I'm going to be going through in order to really help out my community. I live in a small rural community in southern Arizona and I feel that I can help a lot of people. También hablo español y pienso que hablando español voy a poder ayudar a la comunidad hispana y quitar poquito el estigma de salud mental. What I said there was that I speak Spanish, I want to help my Hispanic community, and I want to break down some of the stigma and barriers related to mental illness in the Hispanic community. I plan to do a remote telepractice at first, probably for the first 6 months while I build a clientele. And then shortly after 6 months to a year, then I'd like to have a physical brick and mortar location where people will have the option to come see me in person or see me hybrid. Realistically, in a perfect world, I'd like to have my brick and mortar practice where I do all my initial psych evals in person and those that want to see me in person. And once that initial face-to-face assessment is done, then I would be comfortable doing follow-ups via telemed, via telehealth, online at home. And overall, the intentions of this channel are going to be to shed light on what being a psychiatric nurse practitioner is. Another goal of this channel will be to be part of the movement of decreasing the mental health stigma in the United States. And that starts with talking about mental illness, specifically for men, specifically for Hispanic men, and did not have that open door communication about talking about our feelings and our emotions. I also like to talk about lifestyle and healthy benefits, longevity, tactics, and tips and tricks. So this channel is going to be about sharing everything I know related to improving longevity and wellness, and it won't all be for me. I'll cite some of the best resources in order to share that with this population. I also want to bring more Spanish education and make a space where people my age can refer their parents, grandparents, uncles that only speak Spanish to get some information regarding mental illness, specifically because we were raised in the United States and life in the United States is so different from where our mothers, fathers, uncles, aunts were raised that it's hard for them to relate sometimes to the lifestyle and the mentality here in the United States. So breaking down that barrier and saying that, you know, we do have a lot more things in common than differences with older generations that have highly stigmatized mental illness. And then other things related to psychiatry, psychology, such as new developments in psychiatry what's working, what's not, different jobs and availability in different jobs related to mental health and mental health care. Also talking about how to avoid burnout in general, and having a conversation to be able to support other nurse practitioners, other healthcare workers, but definitely psychiatric nurse practitioners who are the same shoes as me. And because mental illness is so specific and so unique to each person, I will not be providing any medical advice, any psychiatric advice. I will provide helpful national resources and hotlines that you can call. However, any medical advice or psychiatric advice is best from your own personal provider, your own family that know you and can guide you a bit better than someone on YouTube can that is a provider. So I will not be giving any medical advice on here. Again, welcome to Mental Health Now, and I hope I can deliver and provide useful education and give you a different perspective on what we call life here in America and as it relates to being a psychiatric provider and treating mental illness in the United States. Thank you.